Welcome to Adapting Class. Fundamentals of nursing is the basis of nursing. You can take the NCLEX without mastering this topic. So let's do some questions, high yield fact in a question form. Let's get to it. First question, straightforward, as usual. Which of the following interdisciplinary team need to be consulted? We always forget about this group of people. Very, very important. If you don't know what it is, look at it. It's interdisciplinary. That means there's a bunch of people involved to take care of one patient. The nurse is caring for a client with what? Recent stroke, buzzwords, okay? Who is having issues with dysphagia, buzzword. Which of the interdisciplinary team member are you going to call? Keyword, stroke, dysphagia, interdisciplinary team member. That's all I'm focusing on. My eyeball is right on stroke and dysphagia, and it's a member of the interdisciplinary team. Which of these people deal with the patient who is having dysphagia? One of my buzzwords. That's all. That's the way you approach question. It make it easy that if you focus on the buzzword, you won't be fumbling trying to figure out which is the answer. I know occupational therapy deal with from the wrist down. Physical therapy from the wrist up. Respiratory therapies deal with the lung. The only person that deal with swallowing and dysphagia is a speech pathologist. Straightforward question. Don't struggle. When you see this kind of question, interdisciplinary thing, it's a freebie. You should be able to answer it and move on. So number 4 is our answer. Number 2, this is also a concept I want to bring. We always try to forget about them, but you have to go back to your fundamentals. Which of the following action indicate correct understanding? A nurse is observing LPN administer a Mantoux skin test. Which of those indicate correct understanding? You see the buzzword of in the underline LPN giving Mantoux skin test, and what action indicate understanding? This is PPD test, right? Or I'm asking you, how do you place PPD? For sure, it's intradermal, right? It has to be intradermal. It's not intramuscular. It's not subcutaneous, intradermal. The degree has to be 15 because this is the skin. The only way the intradermal is right here. So the only way you can inject into the dermal skin is to be a little bit parallel. If you go deep like that, you are in the fat. So that's why it makes sense. So the degree should not be more than 15 degrees. So 45 is gone. The needle doesn't have to be long. With long, it passes the dermal space. It will go into the fat. Therefore, you know 1 inch is gone. And therefore, you're left with this. Since this is wrong, and we only deal with 15, so intradermal 15 and 1/4. The needle is 1/4 to 5/8, and that's the size. Therefore, it's between 15, and this is too long, and this is the right answer, 3. You see the way I approach it? It has to make sense to you. Number 3 is the right answer. Question 3. Which of the following indicate positive results? You also have to know that buzzword, positive results. And let's place a tuberculous skin test. I changed the markers to tuberculous skin test so that you can get familiar with when they interchange them. On what? HIV patient. There's a reason why they give you HIV patient. 48-hour results were red. Which one of these indicate positive results? Keyword, buzzword, you have a PPD placed for HIV. HIV is what? Immunocompromised. You bring your content, like I said, ask, case, buzzword, rewrite. So I'm rewriting using my content. That means I place a PPD on immunocompromised patient. Which of these indicate positivity? Keyword. For if you're immunocompromised, greater or equal to 5. If you are at risk, like healthcare workers, those people can get exposed to a lot of people, greater than 10 millimeters. Normal person who is very, very low risk, they are greater than 15 millimeters. We don't have anything 20. So this is normal. This is low healthcare workers, and this is people who are at immunocompromised, like HIV. So 5 is the right answer. Number 1. Number 4. Same strategy, right? Which of the following right of delegation was violated? Bringing you back fundamentals. The nurse delegate an AUP to administer a nebulizer treatment to an asthma patient. Something should be ringing in your ear. A UAP giving a nebulizer to an asthma patient is inappropriate, right? It's inappropriate. Circumstances is like situation. Somebody is in emergency or something like that. That's when you do. Supervision, you dare to help them, supervise them. The place is the right place where they needed to be giving that medication. And tax is somebody who has competent, appropriate, delegated to somebody who we think is safe. It does not need any instruction. Does not need any repetition. And so, which does not need any supervision. So you give the right tax to somebody with competency. So what was violated is the tax was not appropriate for the UAP. The tax is not appropriate because the situation does not show a circumstances or supervision or a place. It's inappropriate tax, and she should refuse it. Number 5. Which of the following need immediate intervention? Select or apply. A nurse is observing an LPN prepare a sterile field. Which of these need immediate intervention? You have to know how to ensure the sterile field remains sterile throughout the procedure. You cannot reach across the sterile field. You can't do that. So this is wrong. You cannot turn your back to the sterile field. This is wrong. The nurse held items 3 inches above the sterile field is to be 6 inches. So this is wrong. The LPN discard torn sterile packages. That is good. The LPN touches the inner 1-inch border of the sterile field. That is wrong. If this is the sterile field, the inner 1 inch, so from here, this from here to here, if this is 1 inch, is not sterile. Here is sterile. So if it touches there, that's not good. Which of the following need intervention? There's one, this one, this one, this one. 1, 2, 3, and 5 need intervention. 4 is right. Number 6. A nurse is suspecting a client with what? Pneumonic plague infection on the med-surg unit. Which of the following is indicated? This is a select infectious disease, so pay attention. You have to know what pneumonic plague is. That's all. If you know what it is, the rest is easy. Infectious control, pneumonic plague, this is droplet precaution. And in droplet precaution, of course, private room. But they don't need negative pressure room. Client wears surgical mask within 3 to 6 feet of the client. Excellent. The nurse wears surgical mask, or the nurse wears surgical mask within 3 to 6 feet of the client. Yes, the client wears surgical mask for X-ray here when he's leaving the room. Nurse put on a gown and gloves for patient care. No, this is for contact. The nurse cannot put on gloves and gown for a patient who has droplets. It's for contact precaution. So the only thing that is appropriate is private room. The nurse wear surgical mask within 3 to 6 feet of the client, and then the client wears surgical mask when going to the X-ray. They don't need a negative pressure room. Number 7. Select or apply. And this is observing a client in seizure, right? I'm taking concept, I'm making questions so that the more I repeat them, when you see it, you go and take a test, it's like a breeze. Because these are the concepts they'll be testing on, seizures, all those things, precaution for. Which of the following action is appropriate? Somebody is having seizures. There is key concept you have to know. There's certain things you should do and don't do. The don'ts and then and do's, right? Next, attempt to place a bite block in the mouth. No, that's wrong. You're going to aspirate, it's going to be a problem. You don't put anything in your mouth. You don't put a tongue depressor in their mouth. Let them do their thing. When they finish, then you can examine them. Client is in the left lateral position. Yeah, this will prevent aspiration. Next, document onset of the seizure. Yeah, so that you can know the time and the duration. And if they keep on having it, you know that they are in status epileptical. That is very important. Next, note the type of movement. Yeah, you want to know if it's a tonic, clonic, or just a tonic movement. You want to know what kind of movement so that you can classify the seizure and you'll be able to treat it appropriately. Next, hold the client's legs. Don't touch them. No restrictive maneuvers. Let them be, let them do their thing. And then when they're finished, you can document and you can take care of it. But don't touch them, don't do anything. No restriction in when they are having seizures. Number 8. Select or apply. A mother brought a 2-year-old boy to the PEDS ER due to what? Projectile vomiting, decreased oral intake for 5 days. The client is what? Lethargic. Which of the following findings the nurse should expect? Breaking down. I've analyzed all the bad ways. A 2-year-old came to the emergency room because he's been vomiting for 5 days and he's not eating for 5 days. No brainer. He has lethargy. That is your buzzword. A lethargic patient due to dehydration means I should see signs of dehydration. That's all. Tready pause, excellent. When you dehydrated, your BUN go up. Your central venous pressure, CVP, normal is 2 to 8. Normal 2 to 8. Therefore, 15, that means you are fluid overloaded. There is no way somebody is lethargic. When you're vomiting for 5 days, he's going to have a CVP of 15. It will be very, very low, maybe 1 or 2. Therefore, this is not expected. Specific gravity, urine specific gravity. You have to know this number in case they don't give it to you. 1.003 to 1.030. This is your normal urine specific gravity. Look at this. This is still in the middle. It's normal. The kid urine specific gravity is not going to be normal. It's going to be high. It's going to be greater than 1.030. Therefore, this is wrong. Of course, his mucous memory will be dry. So 1, 2, and 5 are right. I'm just taking the concept and making these kind of questions more and more so that when you see dehydration question, it's easy. You just don't even have to think about it. That is the way it goes. This is a dehydration question in disguise. Number 9. Which of the following location is appropriate? A nurse plans to administer a viscous medication via the intramuscular route. Okay, very, very viscous via intramuscular route. This I should have put in an adult. So I'll put here. In an adult. Which of the following location is appropriate? So a nurse plans to administer a viscous medication via the intramuscular route in an adult. Which of the following location is appropriate? Iron medication, you can put in the deltoid, vastus lateralis, and ventrogluteal. You don't put it in abdomen. But in an adult, the best route is ventrogluteal area. You can give it to the deltoid, but the lesion is what? Viscous. Deltoid, you use it for just a clear liquid, not a viscous lesion. And lateralis is for children. So that's how you can break the question. 1 and 3 are good. for adults, but because this lesion is viscous, we'll put it in ventrogluteal area. And 4 is not route for intramuscular. Number 10, select or apply. And let's read the label of a TPN prescribed for a client with dysphagia. Which of the following the nurse you expect to be included in the TPN bag? Straightforward. What do you see in the TPN? That's all. That's what the question is asking. So we have a patient, we need a TPN. I'll look at it and say, what should I expect? TPN should have what? Vitamins in it to provide to the patient because they're not eating. We get our vitamins from diet, so they don't eat it. You're going to get the electrolyte from the TPN. That's where they're going to get it from. They're going to get their trace minerals from that. This is the key concept. Don't forget, if you see in the test, you can also put regular insulin in the bag in order to prevent hyperglycemia in some patients like diabetes or anything like that. But NPH, no, you don't put it in the bag. So the only thing they will see is 1, 2, 3, and 4. Most of the time, there's no regular insulin, but there's some situation they can put regular insulin in. If they have to put insulin, it's going to be regular insulin, not NPH. So 1, 2, 3, 4 is your right answer. Number 11, same strategy. Which of the following the nurse should have available to prevent complication? The client is receiving TPN for dysphagia. The TPN will stop abruptly for an MRI. Which of the following the nurse should have available to prevent complication? Have available to prevent complication. What is the problem? Abrupt TPN. You see what I've underlined? Those are your buzzwords to keep you focused. TPN, abruptly, I should what have available. It's a combination. You see, I'm making a sentence. If you're on TPN, we stop it abruptly. What should I give you? Not normal saline, not LR, not albumin. Albumin is for somebody with ascites. LR and normal saline is for resuscitation. Thus, is D10. You need to give them glucose so that they don't get into trouble. So that's the right thing, right medication. Number 2. And the last one. The last one is I want to see if you remember your fundamentals. How much should the nurse administer using a tablespoon? A nurse receive an order to administer 15 teaspoons of Tylenol to adults due to dysphagia. The nurse can only find what? Tablespoon, can't find teaspoons in the word. How much should the nurse administer? This one, no mess, you have to know. 1 tablespoons is what? 3 teaspoons. Therefore, we have 15 teaspoons. We should get what? 5 tablespoons. So she only gave tablespoons. She should give the kid 5 tablespoons if instead of 15 teaspoons. So instead of 15 teaspoons, we're going to give 5 tablespoons. So the right answer is this. This is just a concept for you to know. That's all. Probably you already know, but it's a bonus question. Take care of yourself. Thank you for playing Adapt NCLEX Fundamental of Nursing. If you've not subscribed or you are not a member, join our membership and keep charging as always. Take care. Bye-bye.